All right, everybody. We're going to talk about chapter 24, which is the nutritional chapter. Now, you guys already had nutrition, so there's only like some things that I'm going to focus on, and I'll tell you what you need to know, but we'll go through some things right now. Now, when it regards to the testing, if we have computer, I'm trying to think if I'm going to add this on or not. I'll add them on if we're going to do computer testing, or hopefully, we'll see each other for maybe the last day to do paper test. But anyway, we're going to talk about the nutritional chapter. And like I said, you already had nutrition, but these are some basic things. So I'll tell you exactly what you need to know. So when I say know this, that's what you need. But I'm going to go over some things right now. We do need vitamins and minerals to maintain your body's function. Healthy diet is the best way to get what our body needs. And if you get too much of something, then you'll have toxic effects. Pregnant, if ill or nutritional deficit needs, you may need some extra vitamins and minerals depending on what's going on. You may need extra vitamins and minerals. Doctor can prescribe them. You can take multivitamins. So there's many things out there. If you need certain vitamins or minerals, doctor can order just like they do like meds, like if you need calcium, if you have osteoporosis, they may want to give you calcium. Maybe you're vitamin D deficient, they can actually order you vitamin D. So those are some things that they can do. Now we know that there are vitamins. There are 13 vitamins that the body need. We have water soluble and we have fat soluble. We know our fat soluble vitamins are A, D, E, and K. These are stored in the liver and the fatty tissues. They leave the body slowly. They're not affected if cooked. They're not needed to take every day. Okay, these are the ones that you take what the recommend daily balance is. If you take more, it can cause a lot of harm because how it is stored is in the liver and the fatty tissue. Now, our water-soluble vitamins, those ones dissolve in water. They're not stored in the body. They're found in plants and animals or supplements, and they are lost during cooking. So they will actually get rid of them during cooking. And there's many of them. There's the C, you have your B complexes. There's many of those out there. And these are your water-soluble. So whatever you take in, you actually urinate them out. So a lot of times when people take vitamins, they'll notice that their urine is a pretty yellow because they're actually excreting what their body does not need out, and that would be the water-soluble vitamins. Now, on page 391 and 392 are a lot of your common vitamins that you can look at, and it's going to tell you their actions, deficiencies, and things like that. There are many different types of multivitamins out in the world. You'd be amazed when I look on the list of when someone goes, I take a multivitamin, in a whole tons of them pulls up like minerals, some have iron, some have different things. It's amazing how many vitamins are out there in the different types. We do give them daily. The diet, of course, like I said, is the best way to get your vitamins, but sometimes we need to boost our diet or the body needs more to keep up with demands. And like I said, that's more with your pregnancy population, your illness, or dietary deficiencies. Side effects for, of course, our vitamins would be constipation, nausea, and an upset stomach. And those are some things that can happen. Now, adverse effects for our multivitamins, of course, they can have allergic reactions. So you can have rashes, itching, swelling, dizziness, problems breathing. Before we give any vitamin, we want to make sure any allergies in the past, a list of all the medications they're taken as well as over the counters. We need to know medical history. Do they have a history of alcohol abuse, liver problems, or GI issues? Because remember, some of our fat solubles are stored in the liver. So that's something we need to know. Do they have an alcohol problem? Do they have any liver issues? So we need to check on that. I already said we need a full list of all the medications that they're taking. Afterwards, we're going to watch for signs of allergic reactions and report that. Now, this is important. Multivitamins or MVIs, you need to watch for constipation and nausea. It is not uncommon for those medications to cause nausea and constipation. All right, so that's important. We're going to teach our patients, teach them foods that are good sources of vitamins. On page 391. Oh, is it 391? Like I said, 391 and 392. Again, those are the ones you're going to be looking. Shows the foods high in vitamins. You're going to teach why they're on the vitamin. You don't want to take more than prescribed because it can be toxic. You don't want to take a variety of supplements unless it's okay by the doctor. Remember, a lot of those supplement things can cause problems with certain medications. So you want to make sure it's okay to take beforehand. So we want to make sure that that our medications we are taking don't interact. So we have to make sure it's okay by the doctor. We want to make sure we maintain a balanced diet. Very important. This is another one. Diet is the best way to get vitamins and minerals. Okay, so that's even if you're on a multivitamin, you must still watch your diet. So that's important. Another thing that's important, so this is another important thing, upset stomach, take it with food. So it upsets your stomach, take it with food. So that's important. All right, now we're back to knots. All right, children, doses are different than adults. You want to make sure you keep the vitamins out of the reach of kids because many kids will overdose on the vitamins. And it happens very frequently. We see a lot. So then we're treating the patients. We have to look at all the different vitamins, the minerals in there, and treat them according to how much is in there because they can overdose on certain things and cause problems. So this big issue with that. Like I said, those Flintstone vitamins are delicious. All right, so pregnant and breastfeeding population, it does pass in the breast milk. Pregnant population should take prenatal vitamins because it has that folic acid, which they need early in pregnancy to prevent the brain and spinal cord deficits. So that's why it's very important for them to make sure that they take prenatal vitamins. The older population don't really need vitamins and supplements. They do need extra vitamin D, especially for bone health. So they need vitamin D. So those are dealing with that. Now, when we're talking about minerals, okay, minerals, there are two types. We have macro minerals and trace minerals. The macro minerals are needed in large amounts. The trace are only needed in small amounts. So our macro minerals would be like calcium, phosphorus, magnesium, sodium, potassium, chloride, and sulfur. Now, our trace minerals, which we need small amounts, would be iron, manganese, copper, iodine, zinc, cobalt, fluoride, and selenium. Those would be our trace minerals. Again, healthy diet is the best way to get your minerals. You can be prescribed if you have a deficit in any of the minerals. You can get it prescribed. Minerals can be combined with vitamins for daily supplement, so that's not uncommon. So on page 394 and 395 are going to be all your minerals, sources of food, your deficiencies that you can look at. Minerals can be found in soil as well as water. You get them from consuming plants, fish, animals, and fluids. You can give them once or twice a day, depending on what you need them for. But like I said, diet is going to be the best source. Side effects for these, they will upset your stomach. You can get a nasty taste in your mouth as well as a headache. If you take large doses of it, it can actually stain your teeth. It can increase urination, cause stomach bleeding, irregular heartbeats, confusion, and actually muscle weakness. So large amounts of these are not good. Adverse effects, of course, we want to watch for allergic reactions. Before we give these meds, we want to make sure we know everything they're taking over the counter, if there's any allergies. We want to know if they have a history of anemia, liver problems, or metabolic problems. Give with food if it upsets your stomach, and this is important. Deficiency in the mineral iodine will show you will have signs of a swollen thyroid gland. So that's an important thing. Deficiency in the mineral iodine will lead to signs of swollen thyroid gland. And we talked about iodine salt when we're talking about the chapter with thyroid gland. Afterwards, we're going to monitor for any adverse effects that could occur. We're going to teach the patients if they're on potassium, no salt substitutes because it contains potassium. Low salt diet. Watch supplements because they can increase sodium. Don't take after you give antacids because of the absorption. So 1 hour before, 2 hours after. You can take with food if your tummy hurts. That's not a problem. And this is important thing to know. Iron. If you're taking anything with iron, it will cause your stools to be dark in color. This is normal. That's a normal thing that occurs with it. Now, the only issue is you may have to check to make sure that the patient is actually it's due to iron and not bloody stools because it will be black in color. And a lot of times people confuse it for blood. So they may have to do an occult to make sure that it's iron that's doing it, not the blood. All right. So children, it's available in liquid or chewables. We want to always keep it out of the reach because of that. Here's another thing important. Fluoride. Fluoride helps children's bones grow stronger and prevents tooth decay. So fluoride is very important for our children population, because it will help with their bone growth. It will make them stronger and also prevent tooth decay. So that's important for the children. All right. It does pass in the breast milk. Talk to the OBGYN. And usually our older populations have poor diets. They will need mineral supplement. They need more calcium in their diet because of the bones to prevent osteoporosis. So that's very important for the minerals. Vitamins, they need the vitamin D. For the minerals, they need calcium. All right, so there are different types of nutritional supplement. When people don't get enough adequate nutrition, then they need supplements. We can give them through the GI tract. We can do enteral nutrition. So we can give them by IV or parenterally. And usually with this, we would give something called TPN, which is total peripheral nutrition. You usually need a central venous access, like a PICC line or a triple lumen catheter. And usually we give it, we use a sterile line. That means nothing else is to go through that line, no lab draws, no nothing. It is only used for TPN. It has to be a clean, sterile line. Pharmacy usually mixes the concentration that is ordered by the doctor. You can go home with these. A lot of times you'll see a lot of people that have lost a part of their small intestine are on TPN, total peripheral nutrition. But there's a lot of minerals and vitamins in there that they need because of their body's not able to digest a lot of stuff because they lost a lot of their small intestine, so they're not able to absorb all that. Enteral nutrition is preferred if the GI tract is working properly. Take a pill. It's given directly into the stomach or the small intestine. We can give it in any setting, in the hospital, home, extended care facility. Cancer patients, neurological or GI problems, or traumatic injuries to the GI tract, anorexia, poor problems with intake, coma, if they have head or neck traumas, critical illness, burns, we can actually use the enteral route, which would be like a nasogastric tube, or we can use a nasojejunal tube. We can use a PEG tube, which is percutaneous endoscopic gastrostomy, or we can use a G tube, which is gastric tube. So there's different tubes that we can use if the patient is unable to swallow, or if they can't eat. We can actually put in one of these special tubes to help with that. Depending on their illness, we may have to do it. Many different routes of enteral feedings. There's many different varieties. There's over 100 varieties of enteral tube feedings, and each one depends on what's going wrong with the patient. There's different formulas for different diseases like renal, respiratory, or diabetes. There's 3 classifications of enteral nutritional formulas. We have the standard, which is very cost effective, which could be Gevity, Osmolite. We have our elemental, which is pre-digested formula for patients with GI dysfunction. Then there's specified, and that's specific for certain diseases. It's more expensive, like Glucerna, Nephro for the kidneys, Pulmicare, or something that are high nutrition, if they need a high protein. So those are going to be specialized. Side effects. Anytime you have tube feed, the side effect, and this is important to know, is diarrhea. If it looks like it's liquid and it looks like diarrhea going in, it's going to come out looking like diarrhea. So the main side effect for tube feed is diarrhea. You can become constipated with it. It can cause some nausea and vomiting, but diarrhea is the big, big, big thing. The side effects will go away once you get used to the solution, but at the beginning, you'll expect the patient to have a lot of diarrhea. And sometimes they have diarrhea throughout the entire time they're on it. Adverse effects, prolonged diarrhea can cause imbalance of electrolytes. Aspiration and aspiration pneumonia. That's why it's very important when people are on tube feed, we do not lay them flat on their back. We always make sure that they're up maybe 30 degrees. We want to make sure they're not lying flat. And if they are down a little bit, we want to make sure we turn that tube feed off while we're turning them and repositioning them. So before we give, if we're giving an NG tube or NJ tubes, we want to make sure placement at the bedside. We want to confirm placement with x-rays before we start any type of fluids. So we want to make sure that it's actually in the nose and it's going into the correct spot before we start any fluids, because if it's in the lungs, we do not want the patient to have aspiration. So that's very important to make sure that we check the placement of that tube. G-tube or PEG tube, that's a surgical procedure that's put into the stomach. We always want to make sure we check for placement and residual. We always want to make sure the patient's bed is at 30 to 45 degrees. We're going to check eyes and nose every shift. We're going to check electrolytes. And this is important. 4 hours of solution should be hung to prevent bacteria growth. If you do not have a 24-hour container, okay? So if you're pouring cans into a bag, or you have solution that you have to pour into a bag, you only put 4 hours worth because you do not want the bacteria growth to occur. Now they do have 24-hour bottles that you do hang for 24 hours. And after the 24-hour use, you have to dispose of it and start a new one. But if you're going to use solution to put in a bag, only 4 hours worth of solution. We want to make sure we get a height and weight, because a lot of these things are based on height and weight. We want to make sure we check a gag reflex, and then supplies at the bedside. Afterwards, we're checking eyes and nose. Very important to make sure, very important to flush that tube so it doesn't clog. Okay, head of bed elevated, monitor labs, check daily weights, monitor bowel movements and report if anything abnormal, or if they continue to have diarrhea and not getting enough supplement, you think. Some meds we must hold tube feed for some time, like Dilantin or phenytoin. You have to kind of hold the medication for some hours afterwards. Make sure you shut off the tube feed if you lay the patient flat to prevent aspiration, and we talked about that. We want to teach our patients how to use the tubes in feeding, how to use the machinery to it. Very important to flush the tube to prevent clotting. Clean and protect the skin of the G-tube. Head of bed elevated at all times. If you're going to lay down, then turn off the tube feed. And remember, this is, like I said before, this is important. 4 hours, hang enough for 4 hours only because of the bacteria. But there are 24-hour containers that can hang for 24 hours, just depending on what you're getting. Report diarrhea or constipation, okay, if it is continuous, because we do expect to see some diarrhea with this tube feed. Children, it is given to the pediatric population, just depending on their illness and that. Pregnant, we can use it if they have persistent nausea and vomiting to help give them a boost. And our older population, this is where we're going to see the problems. These are the ones that we're going to see due to nutritional issues, swallowing problems, maybe they had a stroke, decreased appetite, not eating enough, and certain diseases will cause it. So basically not too much in this chapter because you guys already had nutrition back then, but that is the end of chapter 24 with nutrition. Any questions? Again, you know where to get a hold of me. Call me.